Musicians and medicine is a discipline of contemporary medicine which deals with musicians' diseases, for example, diseases of players in the orchestra and soloists. In the past, and more intensely in last years, many medical examinations have been performed and the clear and transparent statistics have been created. It was found out that especially brass instruments with the use of high range, mainly a trumpet, may cause serious health damage in the area of lungs and cardiac circulatory system. While producing high-pitched and loud tones, a massive overpressure in the thoracic region emerges and it reaches up to 140 millimeters of mercury. If we imagine 140 millimeters of mercury, it is an extreme organism burden because according to general medicine, the high blood pressure begins at this point. Considering the conventional way of playing, the human body is exposed to a great pressure, not only on lungs, but also on the heart and the circulatory system. The available literature does not exclude the possibility of a stroke or a heart attack. Of course, we were wondering if Mr. Dostal suffered from any health damage connected with already mentioned lung or heart diseases. Therefore, we performed a measurement of lungs function and it showed that Mr. Dostal has no disorders and his vital lung capacity is above the average. No damage which would cause asthma or chronic bronchitis was found. We also performed ECG and ultrasound examination of his heart. In the ECG, there were no changes which would point out a disease, and the ultrasound examination also did not show a heart valve disease or a muscle hypertrophy, that is, a loss of muscle tissue. In recent years, Mr. Dostal-Berg has undergone regular medical examinations, during which we detected absolutely normal results of blood tests. Now, we are wondering if the blood pressure values measured while being relaxed will change while playing the trumpet and if the blood pressure will increase so that it is dangerous for him. This unconventional cardiac stress test showed that Mr. Dostal-Berg's blood pressure and even his heartbeat did not increase significantly. It means that the method of playing the trumpet, which Mr. Dostal-Berg has revived and practices, does not cause any health damage. Mr. Dostal-Berg will undergo an unusual ECG measurement under load. Usually, the cardiac stress test is performed on a stationary bicycle in the surgery. However, we will perform the measurement differently. The stationary bicycle will be replaced by an authentic Clarina trumpet and a modern trumpet. I will set the ECG electrodes and automatic blood pressure measurement, and then Mr. Dostal-Berg will start playing the instruments mentioned. Now, we will start with the mentioned load, which is playing the trumpet. it is clearly visible that there is no change of the original shape of the lips, as it was in the case of the trumpeter Dizzy Gillespie, whose lips were pressed inwards and scarred. There is no detectable deformation which would point to the change of their original shape. On the contrary, the lips are completely intact as well as their motor activity. There are no scars or hyperplasia, which is a tumescence of mucous membrane or something similar. The ultrasound image shows a well-developed musculature of the lower and upper lip, which is maintained completely and without any damage in its structure. There is also no detectable damage of mucous membrane in the mouth on the inner side of the upper and lower lip. And if we focus primarily on the condition of the teeth, we can see that they are perfectly fine, without any deficits, and completely preserved in their original shape, as someone who never plays the trumpet.